So today we're going to talk about how a movement screen can help us understand what's going on with our lower back. It's really important. Now, when we use that movement screen with questions that we ask to get an understanding of like what's going on, what makes their symptoms better, what makes their symptoms worse, does their pain come and go, really diving deep into understanding how their body responds to certain movements, that also gives us really good information. But we can use that information and go, okay, we think this is probably what we're going to see, but let's go and test it. I always say where the side of the pain is often not where the source of the problem is coming from. You can have issues in your thoracic spine that can create pain in your back. You can have issues in your back that can create pain in the back. You can have issues in your hip that create pain in the back. You can have issues in your hip where it's coming from back pain. You can have issues in your hip that's coming from hip pain. So you really have to understand the body, and the movements help us understand where we need to go, and they're great baselines for us as well. So we're going to get into a little bit about movements and what it tells us. So a big one that we look at when we see, we'll also lift up their shirt back behind here to kind of see what's going on in this lower part of this back. And so one of the things, that we look at is, yes, we look and see how far they can kind of go forward. What's the quality of movement? Is there some fear there? What does it feel like when they come back up? Can they get through their full motion? Those can be used as baselines. Extension actually gives us a lot of information. So when you have someone that goes in and they're only moving from their thoracic spine, they're not getting anything down that low part of the level moving. We know that the whole lower part of the spine is not moving. Other things that we'll see is when they come back through here, sometimes it's that their hips won't move forward. So if their hips can't actually move forward to get some of that motion, and they're just moving like this to go forward, to go backwards, we're also going to look at, okay, let's go and see what that hip mobility looks like as well, because we're normally able to move the hip forward, but when the hip doesn't move very well, you're going to notice some differences, or maybe they'll have a little bit of rotation, like this hip will move, but this one won't move. So those are things that we look at to go, okay, let's go dive in a little bit deeper, and let's go see exactly what's going on with those hips, or let's go see exactly what's going on with the back. And so those are the areas that we look at. Other things that we look at, we'll see people that literally will have a fulcrum. And so they'll move and they're only going to move in one area, and literally that they hurt right through here, and they only move through there, and their thoracic spine is super straight. They don't move down below. They only move in that one spot. We talked about that before. Very common what we see when someone has a slipped disc forward, or they call that a spondylolisthesis. When it's slipped forward, it's there's a fulcrum there. So nothing is moving above it. Nothing is moving below it. You're only moving at that one spot. So then we start knowing, okay, we've got to see what's going on above it, and we need to see what's going on below it. So those are all different ways that we look at from an extension standpoint of what we need to do and where we need to address it. Now, if we think there's some issues with the hip, we will start moving people into hip extension. That's when the leg is moving backwards. So we can kind of see how far does this move. We'll look at rotation, because a lot of times they'll be locked up going this direction. They might be able to go this direction, but they'll get locked up in that and going into that internal rotation. And so when you go in and you're rotated, then your hip won't be able to move as well. And so we have to bring it back into the center. And so all of a sudden, that's going to make everything open up, and all of a sudden their range of motion and their back improves. So there's a lot of different things that we look at and knowing what area that we want to go in. But that's looking at it from this sagittal plane, which is that forward, backwards, that frontwards, and that in extension ways. We also want to look at how their side glides are moving. If they move this direction, but they can't move this way, that gives us an indication that in their back, there may be an issue where you have a little bit more of what we kind of call a lateral herniation, potentially. Now, we can do things where we work on the back and we move into extension, which is we always kind of want to stay in this plane first. And as we move them into extension, as they're bending backwards to kind of retest that, all of a sudden the side glide motion opens up. But there's times when we're moving to extension and it's making them either worse or they've plateaued. and they have this, what we call lateral component, they can't move as well to one side, then we know that we might have to actually move them in a lateral position to unlock the joint. I know this sounds very complicated. It is and it's not. It's not complicated to us. We have this whole process of like ruling things in and ruling things out, but it gives you an idea of like what our evaluation process is like and why a 5-minute conversation with a doctor or just go and do these few exercises, core strengthening exercises, why it's not solving your back pain. We have people that can have issues in their thoracic spine, their back, and their hip. They can have a combination of things, or it's their back and their hip. Often we find when people have back issues, there is a component in the back, but there also is a component in the hip, and we have to kind of solve all of it. We've had times where we've noticed that people, if we don't like look above and below where the pain is, and we don't solve the things above and below, it can be, well, the thoracic spine's not moving, the muscles are tensing up. Yeah, we're fixing all this, we're releasing everything, but we didn't solve the part of the problem, and so their symptoms will kind of come back again. So these are all ways how movement can help us understand a little bit about what's going on and where we need to go. And depending on what we find is then allows us to understand a little bit more of like what we need to give them as far as exercises, where we go manually. If there's a hip issue, then we start working on hip mobility, stretching the joint while releasing some of the tightness at the same time. We have a technique that we use that works very, very well, and then teaching you how to improve that mobility. If it's back stuff, we find the direction that's really going to open them up. A lot of times that's extension. That's moving into some extension positions because we do so much bending throughout the day. We've got to offset some of that bending. But there can be a lateral component to the back, and that's where when we do that, there's so many different variations. I can't even get into what those variations are. I will definitely confuse you if we do that. But just know that if you can't move here very well and you tried extension where you're doing kind of some press-ups like these, you're going in and doing some press-ups where you're just moving in this direction quite a bit to go in and then retest your motion again. If the motion improves, then you know, okay, extension is going to help. But if it doesn't, and or it's making you worse, or it's just not doing anything, then you either need to add a little bit more force on that, or you need to get to someone that understands the back and knows what those next steps are, because there's a lot of next steps that we try, and it can get very confusing, and it's much easier getting to someone that understands the back to help you navigate that better. You will get better results, you will get faster results, you'll get your life back faster when you can get to someone who really understands this. But I'm hoping this helps in the sense of, oh wow, if I go in and I can't move and my hips aren't moving forward, I kind of look like this, I know there could be a potential for a hip component that we need to address. In that way. Or if I know that I'm having pain in this one particular spot and I'm moving in that one particular spot, then I know I need to start stretching above that spot and below that spot. And there is a video that shows you exactly what I'm talking about when we talk about those areas. So the movement helps us really understand the body a lot better and knowing where to go. And then we use those movements as baselines so that when we retest it, we're looking at the quality of the movement, how far they're going back, their pain levels while they're doing it, and whatever symptoms that they notice. They're baselines for us so that we can understand your body, so that we can navigate your body specific to you, and get you back to doing the things that you love. My name is Stephanie. I'm with Empower Physical Therapy, and we help clients every day avoid surgery, injections, and medications while getting their life back. We often say where the side of the pain is often not where the source of the problem is coming from, and it's really hard to do that in a 5-minute conversation with a doctor's office or getting an MRI that can show you a lot of things that have been there for years, and it's just a part of our aging process versus that's what's actually going on. So if you like what you hear, make sure you subscribe to our channel, like this video, and make sure that you comment if you have any questions down below. Until next time.